chiropractic office here in Clark. We've been here for over 12 years, and I've personally been in this office for 4 years. So this laser scanner, what we're showing a new patient now, is to determine an imbalance in the skeleton, specifically the lower extremities of both legs, as a result of problems in the feet, namely flat feet or pronated arches. And as a chiropractor and an instructional engineer, this is one of the things that we fix on a daily basis to help balance people's spine and pelvis and restore normal function and relieve pain. And this is what we do every day. Hi, my name is Dr. Carlucci, and I have a new patient in my office today. He's Mr. L, and he's here. He's a bodybuilder. He works construction, and he's having some neck and shoulder problems, and we're going to check him out and see what we can do for him. What natural chiropractic care can help him. Have you ever been to a chiropractor before?
No.
No, this is his first time, and it's a brand new experience, as it is for most people. 80% of Americans don't have a clue what chiropractors do. So this is a brand new experience for him. This is an absolute true fact. So now just let me just check you out. Just can you bend your head back? Good. And down. Good. Okay. And turn your head to the right. Good. And to the left. Good. Okay, now as we can see, he's a very muscular man, Mr. L, and he's got very strong muscles attached to his spine. Okay, now, can you just turn this way? Okay, and can you bend down and can you touch your toes? Good. And back up. Good. Any problem doing that?
No.
No? Okay. Now, turn this way. Just want to show your spine here. Okay. Now what I do as a chiropractor, I palpate and I check the postural analysis of the spine to see where the abnormal curvatures are and how we correct them. Because an abnormal curvature will cause pressure on the spinal nerves, the delicate spinal nerves, and cause them to suffer with pain and body malfunction. And let's see, can we just bend to the right, like this sideways? Good. And to the left. Good. And to the right. Good. Okay. So we can see that he does suffer with a curvature of his spine, deviating off toward the left side. It would be considered a levotrorotary curvature of the spine. Okay, and what we're looking at over here is quite simply, this is what we're looking at. Okay, but of course his spine is covered with his skin and the big muscles because he's a big, strong bodybuilder. And what I'm doing is making an analysis to determine how severe this curvature is. The next step will be to take some x-rays of the spine to analyze the curvature and make some measurements. Okay.
Who do I trust? Me.
Hi, my name is Dr. Carlucci. I'm a chiropractic physician and natural health care provider for over 31 years, practicing here in Clark as well as in Jersey City. Right now I'd like to discuss with you the major crux, the major diagnostic problem that we correct on a daily basis is what we call a subluxation. And quite simply, it's a misalignment of the vertebrae in the spine which causes you to suffer with pain, tingling, numbness, or body malfunction. And as you know, a chiropractor focuses on the spine, which is part of the central nervous system, for one reason alone, because the central nervous system controls and coordinates the functions of every other part of your body. In embryology, the first system to develop is the nodal cord, which is called a precursor or the starting of the spinal cord. And in nature, that is done for one reason, because that controls the development of the rest of the fetus. And in the same respect, chiropractors focus on the spinal cord because that's part of the central nervous system, and that controls the functioning of every other part of the body. So what happens? What do I do? As a chiropractor, I check and I palpate the delicate vertebrae in the spine. Okay, each bone is called a vertebrae, and there are 26 movable vertebrae in the spine. Okay, and what I do is I check to see where the vertebrae are aligned, to see if they're properly aligned or not. Okay, many times I will check to see either in the cervical, dorsal, or lumbar spine where these subluxations are and how I can correct them. The next step then would be to take an x-ray. But first I want to discuss that with you now so you have an understanding. Okay, as you can see on this poster here, we can quite literally see how one vertebrae is posteriorly or backwards subluxated, causing pressure on the delicate spinal nerve. Okay, when that happens, the patient suffers with pain, tingling, or numbness, or body malfunction, or muscle spasm. Okay, and this subluxation can occur anywhere within the 31 pairs of spinal nerves within the spine. And what we do is correct those. Quite simply, as you can see, here's a vertebrae. This is a model of two bones called vertebrae, and you can see the spine coming down the middle, the spinal cord, the middle of the spinal canal. Okay, it's about the thickness of your pinky. On the sides are the spinal nerves. Remember, there are 31 pairs of spinal nerves. Okay, normally when the vertebrae are properly aligned, there's no interference and no signals between the brain and the body. Everything functions okay. However, when the bones go out of alignment just slightly, you see the red light? That indicates that there is a subluxation, that's the technical term, or a pinched nerve, a subluxation. Now I'm able to, with my skill, to palpate, to feel these vertebrae, to feel where these subluxations are, and to correct it. And what I do quite simply is give you a chiropractic adjustment, and you hear a little click. And what I'm doing is just moving the bones about 1/8 of an inch to relieve that pressure on the spine, on the spinal nerve, and restore your health naturally. Subluxations can occur anywhere in the cervical, dorsal, or lumbar spine. For brevity's sake, at this time, I'm just going to discuss subluxations in the cervical spine or your neck area. Quite frequently, people have subluxations in the upper cervical, in the atlas. It'll cause them to have difficulty sleeping, insomnia, or even sometimes problems focusing the eyes, or pressure behind the eyes. Many times I've told patients who've been to ophthalmologists, and they come to see me, and the ophthalmologist said there was nothing wrong. Well, there's not an organic disease, there's a malfunction of the nervous system. That's what causes the problem. So many times subluxations can affect either the first cervical, second, third, any one of the 7 vertebrae, causing you to suffer with postnasal drip, dizziness, loss of function, and many other symptoms associated with these nerve root impingements. So as you can see, the spine is very important in the overall control of how our body functions. And this is Rochelle, and she's waiting for the massage therapist to come in and give her a very therapeutic, skillful massage.
It's amazing, Molly. The love inside, you take it with you.